Welcome to the webinar, Introducing Hippocrates. Again, my name is Susan Wilburn. I'm going to provide a quick introduction to the Global Green and Healthy Hospitals, including information about how to join us if you are not yet a member of GGHH and are interested. And then I'll introduce our speakers for the session today, who are Alejandra Livschitz and Scott Slaughterback, both on staff of GGHH. The Global Green and Healthy Hospitals is a worldwide community of hospitals, healthcare systems, and health organizations, all dedicated to reducing the ecological footprint of healthcare operations while promoting environmental and public health in our communities. We do this work through the GGHH Agenda, which, as you can see on the slide, has 10 goals, including leadership, chemicals, waste, energy, water, transportation, food, pharmaceuticals, buildings, and purchasing. For each of these goals, we have a community on Connect, our social media platform. And the subject of today's webinar, Hippocrates, is to talk about how we can use the activities in your facilities and promote their successful achievement through data collection and monitoring. You see a map of the world where our members are located. As of November this month, we have over 700 members from 40 countries, representing the interest of over 20,000 hospitals and healthcare facilities globally. You can see on the map highlighted the countries where we have membership. You can also see marked by a star on the map where our regional offices are, in Manila, in the Philippines, in Brussels, in Belgium, in Washington, D.C., in the United States, and Buenos Aires, in Argentina. You'll also see red dots on the map where we have strategic partners and staff that we are working together with to support GGHH. And those include in Melbourne, in Australia, in Beijing, in China, in Kathmandu, in Nepal, in New Delhi, in India, and Durban, South Africa, and Sao Paulo, Brazil. And welcome to our colleagues from the Philippines and Beijing offices and Melbourne today for this webinar. There are a number of benefits and resources available to members of the network, which we consider a global learning community, and our community interacts on the social media platform of Connect, which contains guidance documents, case studies, and self-assessment tools for each of the 10 goal areas. This session today is one of our member benefits, educational webinars, which we organize about monthly, although we're keeping December, we'll be back in January, and stay tuned for the announcement of the date of the webinar in January. The session today is about Hippocrates, a data center to collect, analyze, and report on sustainability data. You're looking at the opening screen for Hippocrates, which you'll hear more about in just a moment. And the two speakers today who will be presenting Hippocrates include Alejandra Livschitz and Scott Slaughterback. Alejandra is an online communications professional based in Brussels, in Belgium, with more than 10 years of experience in non-governmental organizations and communications. She's been working with us in Healthcare Without Harm as the International Communications Coordinator for over 8 years. Alejandra has a degree in social sciences and communications from Buenos Aires University and a postgraduate degree on NGO management from the San Andres University. She is tech savvy and an online communication specialist and strategist. The second speaker will be Scott Slaughterback. Scott joined Healthcare Without Harm after working for over a decade for Kaiser Permanente, one of the largest not-for-profit healthcare systems in the United States, where he led teams in the National Facilities Services Group, focused on improving the design and sustainability of over 60 major healthcare buildings. Scott developed and implemented sustainability strategies and led the transition of Kaiser Permanente's National Sourcing Agreement Program to become an innovation and market transformation-based purchasing system, promoting the use of sustainable materials. Scott is trained as an architect. And I'm going to turn the ball and the microphone over to Alejandra to introduce Hippocrates. Welcome, Ale.
Thank you, Susan, and good afternoon, good morning to people from all around the world. It's really nice to see some familiar names participating in this webinar today. I'm going to share my screen right now. So, Susan, if you can confirm that you're seeing it properly as soon as it loads.
There it is.
Perfect. Thank you very much. So thank you, Susan, for that introduction to Global Green and Healthy Hospitals. I can recognize from the list that we have some members and some non-members that maybe potentially will join GGHH after the webinar. What I'm showing right now is our greenhospitals.net website, our public website with information on GGHH, and that includes information not only on the network and our members, but also on the different programs and benefits that we have available, currently free of charge. As you can see, we have a different menu and variety of programs to fit your different needs in different parts of the world. And the one that I'm going to be focusing right now today is in our Hippocrates Data Center, a brand international data collection center for healthcare facilities all around the world working on sustainability. So I'm going to show how to access the system and how to navigate the system, as well as focus on some great functionalities that it has. And then Scott and Susan will be deepening on the forms that we have available, especially on energy and waste. But as you can see from the GGHH public website, I can click here where it says Access GGHH Connect, and it's going to bring me to my GGHH Connect social media platform for members from all around the world, where I can find information on sustainability goals, post a question, interact with members, get in touch with experts and share successes, or just dialogue with your colleagues from all around the world. On the right-hand side here, there is a portlet that allows me to access my system. And as you can see, just by clicking on that link, I'm brought directly into Hippocrates Data Center. It doesn't need any further login. All you need is your information to access GGHH Connect, and the system brings you directly into Hippocrates Data Center. From here, members can do a variety of different things. You can, as you can see by clicking here, see your profile information, and even more importantly, add to your profile information. So you can provide institutional information through time, and even more importantly for members, you can suggest other staff members that you want participating either in GGHH Connect or in the Hippocrates Data Center. So you can see here where it says contact person. If I click on this drop-down, I can click on new person and add as many contact people or staff members in my institution that I want participating either in the data center or on GGHH Connect. And what this allows is basically replicate the same structure that you might have on your facilities. We know that some of you are not working individually, you're working as part of teams. And this is a functionality that allows you to tell us as GGHH how many members you want participating collaboratively as part of your team. So, for example, in this test user, I can see if I click on my team, how many members within Healthcare Without Harm Global team are accessing Hippocrates, and what are the roles that what are their roles within Hippocrates Data Center. So here you can see that there is a list of different forms available together with a role attached to it, either administrator, editor, or group member, that basically tells me what the role within the team and in Hippocrates is going to be. So the way this is built is that administrators can submit a form, review data after it has been submitted, and can go back to either exporting all the data or changing information that was there on the history log. Administrators and editors can work collaboratively on a form, and Scott and Susan are going to walk us through two of them. And the idea is that you can, with your colleagues in the institution, just work on the cloud in a secure web-based platform, all together in one safe form, but only one just has the capacity to submit the form. And the idea is that this actually allows as not to have duplicated data. Group members are basically people in your institution that want to access the information and see what has been submitted and export the information and use it, but they cannot start or send a form. So if I click on data forms, what I'm going to see are all the forms available for my institution. So you can see that for this test user, I can access the 2020 Healthcare Climate Challenge forms, and there is a variety of different options and information I can get from each of the forms. I can either start a new form by clicking on the button that says start, or I can see whether if a form is in progress, when it was last edited, and by who. So I can get in touch with Nick Thorpe in my institution and ask if they need help in completing a form, or I can actually click on continue. And if you can see here, it basically takes me to this form that has been started but not submitted, and I can complete the fields that still need to be completed before clicking on reviewing and submitting the form. You can also see that if a form has been submitted, there is another link that appears here that says view submitted forms. And if I click there, it's basically going to take me to an archive. So after members submit a form, two things happen. The first one is very interesting. We have a functionality that builds different graphs and reports with the information that has been submitted. So just a small caveat, all this information is test information that we have been inputting in the system for testing, basically. But going to graphs and reports and clicking on these drop-downs that you see here, I can basically see the graphs and reports that are built automatically by the system with the information that my institution has been submitted. So it aggregates all the information that I have submitted and that my colleagues have submitted and starts building these graphs and reports. And it does so for the 2020 Healthcare Climate Challenge, as you can see, for the energy self-assessment that Scott Slaughterback is going to walk us through, and for the waste self-assessment that Susan Wilburn is going to walk us through. And there is a really great functionality in Hippocrates, which is this option that allows all our members to download the information as a PDF. So by clicking on that button, I can basically either save a file or just open a file, which I'm going to do right now. And as you can see, it exports the information that I have provided. And it exports visually in the same graph formatting that I have it here. So if you need to use this information for your internal reports, you can either export the graphs, or even more importantly, you can go to the archive by clicking on the button on the main navigation menu. That will take you to all the history log of the information that has been submitted. So I can see the greenhouse gas emissions data form for 1991, and I can either view the submission, open the submission, or save the submission as a PDF, as you can see, with all the information that has been submitted, or I can export the information as a CSV. And for those that are familiar with Excel, CSV is basically an Excel format. So if you want to either use this information for your reports or even build custom graphs to report back to your leadership teams in your institutions, you can take all the data that you have submitted and that has been stored in Hippocrates back to your leadership teams and use the data, either from the data forms or from the graphs and reports option. We have created a whole section on health guides because we know our members either need sufficient time to complete a form or they don't have very good internet capacity, so some of them actually need to download a form and complete it offline. So if I click within the help guide section, any of the links here, as you can see, they're downloadable Word documents of the forms with all the mandatory fields marked in red that can be completed by members, sent to GGHH via email, and we as GGHH will be happy to upload that information into your user and system so that if you need to go to the reports functionality, you can see all your data already in there. This help guide section also includes another benefit for members, which are our guidance documents, which we currently have available in these 4 goal areas, and we'll be adding more as we produce more. But these guidance documents, both on waste and on energy, are going to help you while you complete and walk through the different self-assessments. Now, we know we have members from all around the world, so I wanted to show another great functionality that we added to cover all our network, which is the capacity of translating the platform into multiple languages. So currently, we translated the platform into Spanish and Portuguese with the GGHH team from the Latin America office. But for those languages that we were not able to cover, and I'm going to show how it looks like if I translate it to Spanish, you can see that the entire interface is changed into Spanish. But for those languages that we didn't have the capacity within the office, we included an option on Google Translate that basically, if I click on that, as you can see, it translates all of the platform into Chinese. And we know that Google Translate is not perfect, but yet it allows members that do not speak the languages that we have in here to see the forms and complete the forms and at least navigate the forms in a language that is more familiar to them. And this can be done, as you can see, on the spot with as many languages as you need. And with this, I'm going to turn the ball back to Scott so that he can present the energy self-assessment.
Thanks, Ale. Welcome, Scott.
Oh, thanks, Susan. Thanks, Ali. That's a great introduction for an overview on how the program works. I'm going to share my application, and you should be seeing the screen that Ali was showing, which is the opening screen for the Hippocrates Data Centers. Susan, is that what you're seeing?
Not yet. It's still loading.
Okay.
It says we're viewing your screen, and I see Training Center, but no information yet.
All right. Let's give it a moment. And does it look like it's working, Susan, or should I try a different technique?
Scott, maybe try sharing your screen again, or because if you're sharing an application and you're trying to share your screen, it'll gray out the rest of the applications.
All right, I'm going to stop sharing and let me try this differently. So I'm going to have to move this to a different spot on my computer. Hold on one second. All right, we'll try that and try sharing my screen instead. Share my desktop. All right, how about
Looking good.
Okay, so we'll do it this way. Let me just resize this window a little bit so you can see a little more. There we go. So as Ali showed us, we can access these forms through GGHH Connect and in the Hippocrates community. I'm going to show you how the energy form is set up and walk you through the structure of it and what it does. But to give it context, one of the key tools that's in Hippocrates is the 2020 Challenge, which focuses on climate issues and greenhouse gas emissions. And many people, either in relation to their system or in other tools that they're using, have tools that they can figure out what their greenhouse gas emissions are using those tools that are either part of their country's system or part of their own system. But there are also a lot of people who don't. And so for those who don't, we've developed this tool that allows you to identify your greenhouse gas emissions from energy sources. So as Ali showed us, we're going to go to look at data forms. And what I'll do, if I can get this to work, is to actually start a form. So I'm going to scroll down here to where we have energy self-assessment. I'm going to click Start, and it's waiting. And that should give us access to a new form if it processes it properly. Let's try this again. So while we wait, it's taking unusually long. Here we go. Okay, so now you should be seeing a new form, and there's some instructional text at the top, and then I'm going to enter a year, which will be in this case 2015, and I'm going to be entering, so you can enter this data for various years. So let me give you a quick overview of the information in the form, and then we'll start entering data in it, and you can see how that works. So because it's annual reporting, each form in the energy form starts off with what year you're reporting on. Then you provide information about who you are and your team, climate information about where you are, so where your facilities are. And if you don't have information like the longitude and latitude, you can click on this link, and that will take you to a Google GPS site, which allows you to identify your longitude and latitude. Then you can also Google search for your minimum temperature, maximum temperature, and humidity levels. Now, this is information that's really helpful in identifying what type of facility, like what type of climate your facility is in. It's not required information, but I'll show you as we enter it how simple it is if you have the data. So the next area that the form allows you to submit data on is continuous energy use. So typically this would be grid electricity that you receive from your utilities, from the power lines. But in some locations that's not available. So the forms also allow you to provide information about other ways that you're generating electricity. So this would be generating electricity for general use from natural gas, from bottled gas, from liquid fuel like gasoline or diesel or biodiesel, and also from renewable resources. And in a moment, I'll show you how we can enter that data. In addition, a lot of facilities generate electricity for emergency use. That's often a requirement to enable a hospital to be resilient to loss of energy from the grid. So those generators burn fuel and then generate electricity for the hospital to use in an emergency situation. So again, a variety of fuels you can enter data on. Typically, you're probably only using one fuel, but the system allows you to enter data on a variety of fuels. So you may be using natural gas, bottled gas, gasoline, diesel, or biodiesel, or you may be using renewable resources in order to provide your backup emergency generation. So those are kind of the areas of electricity-based energy. But another major source of energy that's consumed by hospitals is for heating. And this is heating both the spaces that people occupy as well as hot water, and sometimes hot water turning it into steam for sterilization and other uses that require steam. So similar layout is what we were looking at, where you have multiple fuels, so you can use natural gas, bottled gas, gasoline, diesel, kerosene, even solid fuel such as wood. And then you may be generating heat with solar thermal or heating water with solar thermal. So you've got two formats for that. In addition, another area of fuel consumption on site is fuel for transportation. So typically this would be for fleet vehicles or for vehicles that are used to transport goods between buildings and between facilities in a hospital or a medical center campus. So you have the typical fuels that are used for vehicles: gasoline, diesel, and biodiesel. So let's take a look at what it looks like to enter that data. While we're on this section, I'll just explain a little bit more about the format. It's set up so that, often people's energy bills come monthly. So it's set up that you can report data for monthly. You'll notice that you can only see, because of the size of my window, to November. So these scroll bars at the bottom allow you to get all 12 months of the year. I'm going to scroll up to the top now and start to enter some data so we can see how that works. So already we entered the year. I'm going to put my name. And since in my hospital I work by myself, so I'm the only one reporting for all these other things, I'll just list myself as the contact for these others. In your hospital, you may have specialist people that you would identify as the contact for those. And then I'm based in San Francisco, California, in the United States, so my latitude is 37.8. My longitude is 122.7. And my minimum annual temperature in Celsius is 6 degrees. And maximum annual temperature in our balmy climate here in San Francisco is 22 degrees. Relative humidity, because it's foggy here in the winter and in the summer, is a narrow range with humidity in the winter at 61%, and in the summer it increases because the fog increases, and so it's 82%. So really pretty straightforward to enter that. You just have to remember that it's in Celsius. Now, as we go back to the grid electricity, electricity is measured in kilowatt hours. So I'll just put in information for January. And let's say we used 10,000 kilowatts in January of electricity from the grid. Now, we're using kilowatts as the common denomination just so things can add up. And to help you with that, the system will translate that information for you. So, for example, natural gas is measured volumetrically. You purchase the natural gas by cubic meter. So if we enter 1,000 cubic meters of natural gas that we're generating our electricity from, you'll notice down below it calculates the number of kilowatt hours. If we already were measuring it in kilowatt hours, the system gives us an alternative to enable to enter the data that way. So we can directly enter kilowatt hours, and as you can see, the calculated is the same as what's entered. But if we enter it in cubic meters, it translates it for that. Now, you see another piece here, a section here that's kilowatt hours. Again, here in this section, we're generating electricity. So this is the energy generated, and this gives you a place where you can enter that. You don't need that information for the calculations for your greenhouse gas emissions, but it was something that was requested by hospitals since you can use this to track your energy consumption as well as your energy generation, that is a field that you can enter that information in. So that's an optional field, but it's there in each of these different fuel types. So often you'll only be, if you're generating electricity on site, you'll probably only be generating from one fuel type. But we offer these others in case you have multiple types of generators, or also so that you can see what the options are to fill that in. Again, the system is the same for reserve or emergency electricity generation. So let's take a look at entering this as a liquid fuel, so this such as gasoline. And again, we'll use 1,000 liters, and it will translate that into kilowatt hours. Again, we have the choice of liters or directly entering that as kilowatt hours. So I think you're seeing the pattern here for how we enter data. let me just scroll down a little further, and so that we can look at the way we've got it structured. So there's two types of thermal energy from solar that you can pick from, flat plate or tubes in meters squared. And again, I would enter the information. In this case, I'll do, let's mix it up, we'll do 2,000. And that's the energy that we're generating from that source. And then similarly, and then let's scroll back so we can see the headings, we can enter that information for our fuel for transportation. And then to submit it, so if you're working on it and you don't have all the data that you want to enter, for example, if you're wanting to enter the data for each month, then you can save it as a draft and come back and work on it. If you want to submit it, the system is set up so that you can review to make sure you check the data is all correct and then submit it afterwards. You may be collecting your energy data just for the year. And so you may be wondering, well, what do I do if I only have months to enter this as places to enter? So if you're collecting the data for the entire year, just pick a month. I'd say probably January or December, wherever you're reporting it. It doesn't really matter. And enter the full amount for the year in that column, and then that will enable you to report your annual information without going month by month. So you kind of have a way of doing it both ways. So to submit it, we'd select Review, and it processes that, which it's doing now. And you get a little notice down below that it's processing it. Okay, and it's telling me that I'm missing a field, but basically what I would do is then hit Submit again, and then submit, it double checks that I want to submit it, and then I submit the information. And now it's telling me that it's submitted. And then it shows me what I have submitted. So once we've done that, then we can go over to Graphs and Forms, Graphs and Reports. And if we scroll down here to Energy Self-Assessments and open that up, we see them for every year that we've submitted data. Here's 2015, where we just were. And you'll see that for grid electricity, we just submitted the data for January. And what you're now seeing is that all that information that you submitted by your fuel source and fuel type is the greenhouse gas emissions equivalent for that type of electricity. In the grid electricity, since the makeup of power plants is different in each country, the grid electricity recognizes what country you're in by your profile and selects the conversion factor that is appropriate for your country and automatically translates it for you. The other conversion factors are more uniform because they're a direct greenhouse gas emissions coefficient for a type of fuel. And while there's some minor variance between one natural gas in one country or another, it's relatively insignificant, so the system just translates a universal coefficient for that fuel. And again, what it's allowing you to see in this form is the greenhouse gas emissions for each month or each year, each month as you entered for all the months, or each for the year as a whole, which is all the information that you've entered. So that you can then pull that information together on what your greenhouse gas emissions are and use that for your own reporting, but also use that to enter your greenhouse gas emissions in the 2020 forms. So that's a quick overview, and if I can stop sharing, I'll pass the ball to Susan.
Thanks so much, Scott. really interesting and helpful. I want to remind everyone that we would welcome your questions. We'll have time at the end. I'm going to demonstrate with Alejandra's help the waste data forms now, but we'll have about 15 minutes at the end of the presentation for your questions. You're all muted, so if you would write your questions in the chat box or in the question and answer field, we'll be happy to respond to them. And you can be specific or not about who the question is for, Alejandra, Scott, or myself. And now, Ale, if you would share your screen.
Sure, can you pass me the ball?
I can. We're going to now take a look at the data forms for the healthcare waste management. And we're going to, if you would back out, Ale, to the home screen so we can go to the data forms first on that tab, or the data forms, and scroll down to waste. And you can see how to start a waste self-assessment. But before we do that, let's go back up to the help section so you can see how to find the help guide and print out the form for the waste self-assessment. So if you click there, the waste form will appear as a Word document. You can print it out, and you can complete the form offline. So the general purpose of the waste data entry forms are to support you, our GGHH members, to achieve your goals, for those of you that have chosen the healthcare waste management goal. And the majority of members in GGHH have prioritized healthcare waste as one of their top 2 goals. And we have, as you'll see on Connect as well as on the greenhospitals.net site, a number of really interesting and useful case studies about waste management strategies. Now, the majority of healthcare waste is not hazardous, according to the World Health Organization. So segregation of healthcare waste is critical to ensure appropriate management and to save money from the unnecessary treatment of non-risk waste when that non-risk waste is commingled with hazardous waste. So that's the first purpose, is to help in achieving your waste goals. The second is to complement the GGHH waste guidance document. And if you'll go back again to the help section just to show where to find the waste guidance document as you scroll down. So there's the waste guidance document. You can download it there. The waste guidance document is also available on the waste community on Connect. So those of you who have chosen waste as one of your goals are automatically registered in the waste community. And as you know, in the waste community, we have guidance documents. We also have additional resources, for example, the WHO guidance on the safe management of waste from healthcare activities. We have a number of experts that will respond to questions, and we have a discussion forum for you to ask questions about waste. So these tools on Hippocrates, the data entry tools on waste, are to complement the GGHH waste guidance document and to provide a tool for you to monitor your progress on waste management. The third purpose of the tool is to help apply the principles of waste management, the 3 R's, as we say: reduce, reuse, and recycle, and to treat and dispose of hazardous healthcare waste in the most environmentally sustainable way. So if you go now back to the data forms, and we're going to take a look at the waste data form live online on Ale's site. And thanks again, Ale, for displaying this. And you'll scroll down and can amend your team's profile if you want, and also choose whether you're going to report the data monthly or annually. So we're going to pick annually. And if you report monthly, it is month by month, and it will be for 1 month at a time and only for 1 year, and it will be the current year. If you report annually, you can select a year, and it can be the current year or a past year if you're just starting using Hippocrates now and you want to enter your previously collected data. You'll see that the red stars are those required fields, so that when you were looking at Scott's field, you saw as he was starting to submit a field that he missed in red. And one of the required fields is the number of beds or average daily census for the year that's selected. So this is your bed occupancy rate, and there is a description of how to calculate the number of beds or the occupancy rate in your facility. And I'm hearing some extra noise.
Okay, one of the attendees got unmuted. Sharwasti. Oh, there it goes.
Thank you. Then there are two, as you begin to enter data, there are two different tools depending on how you categorize your waste stream. And what you see on the screen now is option 1, 3 broad categories of waste, or option 2, 7 more specific subcategories of waste. Option 1, the 3 categories of waste are, and we're going to click on option 1. So you can see these 3 categories are general healthcare waste or non-hazardous waste, biohazardous infectious waste, or hazardous chemical waste. And for these options, you would record the total kilograms of waste for that particular category. And then as you have chosen option 1, you will automatically receive the categories of waste streams for the treatment or disposal method. And for option 1, there are 3 disposal methods: recycling, non-incineration or non-burn treatment, and incineration or backyard burning, any kind of burning, and other or don't know. And if you choose, you can calculate and categorize the amount of waste in each category of waste generated by the treatment method. And so scroll down and we'll say yes, that we want to now enter the data for each type or category of waste stream, enter the amount in kilograms that is sent to each waste stream method. Let's go back and go to option 2 so we can see the difference between option 1 and option 2. So now we're going to scroll down to the option 1 or 2 choice, and you can see that option 2 is 7 categories of waste streams. The general category is the exact same as in option 1. This is non-hazardous waste, similar to household or hotel waste. It can be paper, it could be food, it could be cans and bottles. But the important characteristic here is that it is not waste that requires any particular treatment and is not healthcare risk waste. We have subdivided the category of biohazardous or infectious waste into 3 subcategories, and those are sharps waste, biohazardous infectious waste, meaning the bandages and other infectious materials, and the third is pathological waste, and pathological waste is essentially body parts and those materials from surgical settings. Then we've also subdivided the chemical waste into 3 categories. So those 3 categories are pharmaceutical or cytotoxic waste, mercury, and other hazardous chemical waste. And we have created a category for mercury specifically because of the Minamata Convention on Mercury, which requires all countries by the year 2020 to eliminate mercury-containing thermometers and sphygmomanometers, or blood pressure measuring devices. So as you are assessing the amount of mercury in use in your facility in those measuring devices and phasing them out, this tool will also help you collect that data. in option 2, because it is a more complex waste stream, we have two different categories of treatment and disposal. So treatment is separate from disposal in the entering of data. So you would first categorize your data in the option 1 or option 2, and now in option 2 we have 5 categories of waste treatment: non-incineration treatment that meets the Stockholm Convention, non-incineration treatment, which could be autoclave or microwave, alkaline hydrolysis, a number of methods, composting or biodigestion. The third is incineration that meets Stockholm Convention guidelines. The Stockholm Convention is the Convention on Persistent Organic Pollutants that requires best available technology and best environmental practices for all, in this case, healthcare waste treatment. And we have incineration not meeting Stockholm Convention guidelines. And if you don't know, likely it is incineration that doesn't meet Stockholm. And then the last is open burning or burn barrel, as many facilities. That's the treatment. And then we have the amounts of waste. How is the final disposal? And what you'll see is a number of categories of disposal: recycled, return to supplier for recycling, return to supplier for disposal, landfilled, and we have 2 categories of landfilled: the engineered landfill or non-engineered landfill, long-term storage, as many facilities are storing their mercury until their country has determined the final resting place for mercury that has come out of use in facilities. There's the on-site pit disposal, as many needle pets in healthcare facilities, disposal with municipal waste, that the general waste is often disposed with municipal waste, drain disposal for liquids, and other don't know. And again, as with option 1, you can choose to complete the amount of that waste stream according to the treatment method used, which will bring up this table to complete the types of waste generated by the treatment method used. And we can also then characterize the disposal method according to the type of waste generated. And then what you'll see at the top of this rather complex chart is, and it's more complicated because we have whether the waste is treated or not treated. So you'll see in the 3rd column it says sharps waste, and in the 4th column it says treated sharps waste. So the 3rd is not treated and the 4th is treated, and we make a distinction because we have many facilities that are now treating their sharps waste and steam sterilizing it, and then grinding the sharps and the syringes and recycling and selling the plastics of the unreusable syringes off for cost recovery. Let's go back up again. And as with what Scott demonstrated in the energy, you can, after you complete your self-assessment form, you can save it and review it. And now we're going to look at the charts that are generated. So Ale has just gone up to closing the form and looking at charts. And here you can see a comparison of the option 1, simple total waste generation, and the 2010 data compared to the 2011 data. Now, this is data that was test data and not actual data. But what you see in this case is this healthcare facility decreased their amount of biohazardous waste from 1 year to the next, as well as their general waste from 1 year to the next. And how they did that would be a great case study. And again, this is sample data. And then scrolling down, you can also see the waste treatment and disposal chart so that you can use these charts and print them out as a PDF or upload them into a PowerPoint presentation to display for your executive committee or your infection control committee or your waste management committee to demonstrate what are the volumes of the waste in general, what are your proportions of waste, and as I said at the beginning, according to WHO, that less than 25% of healthcare waste should be risk waste. So that will be a target. If your general waste is more than 75%, you're within a benchmark. And this is how you can continue to monitor your own progress and benchmark yourself against colleagues, where we'll have comparisons by country, region, and globally on the different waste streams and waste treatment. Now we're looking at the annual waste generation of option 2, and you can see that's color-coded by the types of the waste stream and the proportions of the waste stream. And when you move your cursor along the chart, it tells the amount of waste in that category in the kilograms that you entered. Scroll back up to that green line. It's in the charts that we were just looking at, yes, here. So here we're looking at the proportion of waste recycled, composted, or biodigested. This is one of our targets for sustainability, is to increase the amount of waste recycled. As you can see here, 1992 was the best year for recycling in this test data, and the trend is not going the direction we would like to see it in terms of the proportion of waste by volume that is recycled, composted, or biodigested. Now, if you would just go back to the data entry form, I want to show how on the data entry forms for waste, there are definitions of all of these waste streams. And you'll see option 1, just scroll, yeah, right there, that's great. Option 1, the categories of waste definitions, and option 2, these are categories that come from the WHO manual on the safe management of waste from healthcare activities. And you can see that that's highlighted in blue. And so if you click on that while you're doing data collection, it will open that document so you can review yourself the more detailed definitions in the revised edition of the WHO manual. And I'll start with a question from Jerome from Canada. And this one is for Scott. If I understand, you've entered greenhouse gas data for every place in the world, and Hippocrates estimates the greenhouse gas emissions linked to the GPS data you've entered?
That's a great question. Thanks, Jerome. I should have pointed that out when I was talking about the energy form. We do use energy data that's generated by the International Energy Association, and we have it for all the countries that our members are part of. Now, what that conversion is for the grid electricity, because each country's power plant fuel composition is different, and so each country has a different conversion factor for the grid electricity. The other conversion factors are scientific data that our researchers have identified for those various fuels. And while there may be subtle differences between those, the makeup of those fuels in various countries, generally the fuel itself has an international profile for the greenhouse gas emissions from it. So the data that is, to summarize, the data that does associate with your country is the grid electricity. And we identify your country from your profile that you've entered for your facility. So that's one of the things that's automated within our system. Thanks for that question.
Thanks, Scott. Here's a question for Alejandra. How should I choose the team members who will have access to the forms? And are there different levels of administrative permissions so that some of my team can only review forms but not make changes?
Thank you, Susan. That is also really a great question. So we built the My Team functionality to allow each of the staff members to decide the different levels and roles and permissions. We currently, as you can see here, there is an administrator for each team, there is an editor, and there is just a group member. And the intention is that the administrator is the only one within the institution with the capacity to edit a form that has been submitted. So some members submitted information for last year, and after submitting, they identified that they had a number that was incorrect. So the administrator is actually the one that can go in and edit the data. All editors and the administrators can work collaboratively on the same form, but in order to allow the duplication of data, the only one that has capacity to submit a form is the administrator. And the group members are people you want to invite just to see the information that you have here in the system. So they can export information of a submitted form, but they cannot edit information that has been submitted. And you can see here, my test user is an admin, so I can click here on this option that says Edit Roles, and it'll take me to a page that allows me to choose which roles I want to have for each of my team members. And basically that's it. The idea is that it's as flexible as possible to replicate how you work in your institutions.
Great. Could you show again how to find the PDF forms to print out the reports or the data forms?
Absolutely. So if any of our members clicks on the option that says either Graphs and Reports or Archive, you can access two different documents that can be exported. Graphs and Reports, each graph has an option that says Download as PDF. And if I click here, it's going to open an option that allows me to save a document or to open the document. And if you can see here, it's how I exported the energy matrix for all the information that has been submitted. Or for the forms themselves, if I click on Archive, it'll take me to a history log of all the information that I submitted. So I can either view a submission and see what information has been completed by my team members, or I can export this as a PDF or as a CSV, which is a little bit more of use for some of our members around the world because they usually use Excel to report back to their institutions. So, Susan, does that cover the question?
Yes, thanks very much. And here's a question for Scott. Can you identify what proportion of the energy use is from renewable sources using Hippocrates?
Yes, you can. Well, you would identify what it is. There's a place for entering the data for renewable sources for both electricity generated and for heating hot water.
And then is that displayed in a graph? I think that's what the questioner is
asking.
asking.
The question is that displayed in the graph. Currently for the energy form, we don't have any graphs other than the one that identifies the greenhouse gas emissions from the various fuels that you're using. So the place where you could look at that is in the 2020 challenge. There are graphs that relate to the amount of renewable energy that you're generating.
I think Ale's sharing her screen and showing us this. Is that right?
There it is, percent of on-site renewable energy.
Oh, thank you. And I have one more question, and then I'll talk about upcoming events. And that is for someone who's asking, what if I have suggestions about charts that would be useful, or is there other ways that I can translate the Excel sheets into charts for use in my facility?
I'll answer that. So this is a really great question. Everything that you see here in Hippocrates has been built in collaboration with a team of experts working for GGHH and Healthcare Without Harm. but also with the feedback of our members from all around the world. During this past year, I think I recognize some of the names from members meeting, either the one that happened in Denmark or the one that took place in Indonesia. We collected the feedback from all the people that either tested the platform or our GGHH members expressing their needs. And we have a bucket list of things that we're going to be building into the platform next year. So we're going to be looking into adding a global benchmarking option, not only for the resiliency and leadership graphs, but also for all the other goals that you can find here and the reporting that you can find here. That would be one piece. Hippocrates is open to being built with the help of all the Global Green and Healthy Hospitals network members. So if you're interested in joining, and then Susan, you'll probably show the slide on how to do so. You just need to become a member and work with us in making this platform as representative for everybody as possible. And then in terms of building your own graph, if you go to the archive and export the information as a CSV is basically an Excel format. So you can use this information either adding to your own reportings in Excel and use that information to build custom graphs that you might need for your institutional reporting. So all the information that you submit here is not only building into a global collaboration platform and global data around environmental sustainability, but also is information that belongs to you and that you can export and take back to your institutions.
And two last questions. One question is, are these free of charge, and how are they accessible in general? And I think you just answered the question, Ale, but I want to make sure as a question, is it possible to customize the forms in any way?
So to answer the first question, yes. The Hippocrates Data Center, GGHH Connect, the different guidance documents, they're all currently free of charge. You only need to join GGHH, and you can find the instructions in the greenhospitals.net website. And if you click on membership and join the network, you'll find all the information. It's a very fluid and easy process. You just need to download a letter of intent to join and send it to GGHH, and then we will set your institution up with access to all the different tools, the data center, the GGHH Connect platform, guidance documents, case studies, etc. And then in terms of customizable forms, the forms, as well with anything else in Hippocrates, they're open for feedback. So if there is anything that needs to be covered, then we can implement that into Hippocrates. We currently don't have a functionality that allows each individual member to build a custom form, but we are looking into the possibility of building other forms that will be released during the course of next year. So all the feedback in terms of what might be needed, then Scott, Susan, and I here in this webinar, we are the people that will be collecting that feedback and potentially turning that into a form.
Thanks, Ale. A couple of questions for Scott. If I understand, you've entered greenhouse gas data for every place in the world, and Hippocrates estimates the GHG emissions linked to the GPS data you've entered. And Scott, I'm going to ask the second question so you can answer both at once, because they're related. Does the energy data in this Hippocrates form automatically populate the greenhouse gas 2020 challenge form?
Those are great questions. First of all, can you hear me? I think I've turned mute off.
Yes.
Okay. So really good questions. And the substance of the first question is correct, that the technical details are a little bit different. So the way that we know what your country is from your profile, and it's the profile of your team. As you recall, Ali was just showing how the team is structured. And so in that, and as Ali is showing on the screen, the profile, the country for our team, Healthcare Without Harm Global, is Argentina, since that's our mailing address. And yours would be the country that you reside in according to your profile. So that's how we identify the country. Then within that, so the system picks up that country, and it goes through a set of conversion factors that we have for grid electricity for each of the countries that our members reside in. So, and that calculation comes from an international source that currently is coming from the International Energy Agency, which annually publishes conversion factor for the grid electricity for each country. So that's the way that we use to convert that. Now the second question was, does it automatically populate in the forms for the 2020 challenge? And unfortunately, no, it doesn't. We haven't got the technology developed to do that yet. So that may happen in the future, but it doesn't do that now. So what you would do is just print out the form in your reports, and print out a report that would give you all those conversion factors, and take the 3 or 4 minutes to retype it into the 2020 challenge.
Great, thanks, Scott. There's 2 questions that came in for me about the waste data. One question is the waste data calculated in carbon emissions or greenhouse gases? And the answer is no. That's an interesting question, and we have been doing some work about how to make the estimations of waste according to greenhouse gases, but that is not a current feature of Hippocrates. Another question came in on that I mentioned the reuse of waste, and is there a way we can capture this data? The only way we can capture reuse is when the reuse is from recycling, and that's more a cost recovery than a materials recovery. And the way that you would choose option 2 in the waste data forms, and you would choose the yes, I want to complete the data in option 2 according to the treatment and disposal method by types of data set. So then the charts will demonstrate, and the data reports will show how the various waste streams, if they've been treated, and then the treated or untreated waste according to its final disposal. I'm looking to see if we have other questions that have come in. One question, last question for you, Scott, and then I will ask Ale to turn the ball back to me for closing, and that is, can you identify what proportion of energy use is from renewable sources using Hippocrates?
Using the energy forms in Hippocrates, I don't think it actually, you would generate that. You'd probably be able to print out the PDF and then calculate that in a spreadsheet, but it doesn't automatically calculate that.
Ale has already talked about how to find the information on greenhospitals.net for those of you who have joined us today who are not yet members of GGHH and want to access all of the member benefits, including the Hippocrates tool. Yeah. And I wanted to share with you a couple of dates of upcoming events. Next week in Marrakesh in Morocco, for any of your colleagues that may be attending the COP22, the Committee of the Parties for the climate negotiations, we are organizing with our colleagues in the University Hospital of Marrakesh a conference on climate and health. There you'll find on greenhospitals.net the information about how to register. We're still open for registrations. A number of healthcare facilities and CEOs will be attending the climate and healthcare event to demonstrate the importance of health in climate change, and that climate is a health issue. The following week in Kathmandu, the WHO Southeast Asia Regional Office is doing a workshop for countries on healthcare waste management. And a reminder that the deadline for those of you who are participating in the 2020 Healthcare Climate Challenge to enter your data to be eligible for awards is the end of this month, the 30th of November, and will be announced. Last year was the first year of the 2020 Climate Challenge Awards that were announced during the Paris conference, and we'll be making the announcement later this year for the 2020 Climate Challenge Award winners. The eligibility is in all three categories of the 2020 awards, and that's the mitigation, resilience, and leadership and advocacy. I want to thank you all for participating today and look forward to seeing you again on a webinar in January. Have a great day. Bye, everyone.